The eye. We're going to start with the external structures, starting with the muscles that move the eyeball. They're called the extrinsic muscles of the eye. And if you look dead on anteriorly, you can see that there are muscles at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. This is the superior rectus. The one at 3 o'clock is called the medial rectus. The one at 6 o'clock is a little easier to see from the side here. And we'll take this off, and you can see the inferior rectus. And then lastly, you have the lateral rectus, which is, of course, lateral. There are two other extrinsic muscles of the eye. The superior oblique muscle, which is best seen if you take this off and you turn the model here. This is the superior oblique muscle. And then the inferior oblique, you can see as well, it goes from side to side, from lateral to medial. That's the inferior oblique muscle. If we look at the external parts of the eye, you can see of the eyeball itself, the cornea is this transparent anterior structure. The white of the eye is called the sclera. Now this model you can take apart, so I'm going to take it apart. And I want you to see that if we take off the sclera, the eyeball itself consists of this iris, the colored part of the eye, the hole called the pupil. This layer that has blood vessels and nerves is called the choroid, the entire blood vessel layer. Now you can take the model apart again, and I want you to see that just behind the pupil is the lens. And if we put these parts down and look at the back part of the eyeball, we're going to take out this middle region, which is the vitreous humor, and look at the back of the eyeball. So here we have the retina. This white region is called the optic disc. This region here, this very fine little point, is called the fovea centralis. And then if you turn the eyeball for the very last time, you can see the optic nerve, cranial nerve 2, the optic nerve.